Show. My name is Dr. Lederman from Radiosurgery New York. We work at 1384 Broadway, which is a private cancer treatment center, which means we work for you, not the drug company, not the surgeons. We work for you. You are our boss. You are the President of the United States of your body, and we serve as your advisor. So if you have questions or want the free booklet DVD, give us a call during the week. If you have medical questions, call us anytime, 24/7 at 212-CHOICES, which is 212-246-4237. We're going to hear from some new voices about work we do, and then we'll be right back to talk about more cases and more news. Thank you for listening.
With Dr. Lederman, the best prostate cancer treatment is custom-tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. Yeah, we are back. So yesterday, I just saw a man, we treated him last summer for 4 skin cancers. He had 4 basal cells on his face. One was by the eye. We treated him simultaneously, so we got 4 for 1. And he came in yesterday, and he's in complete remission. So he's happy. His family's happy. I'm happy. Everyone's happy. He's in remission. 4 for 1. 4 skin cancers. We treat a lot of skin cancers. Melanoma, Merkel cell, squamous cell, basal cell. We have a lot of experience over many decades. And for him, it avoided the deforming surgery. He came intact, all outpatient, doing well. We had another man who came in yesterday with a Gleason 7 prostate cancer. His PSA was 7.93. He had biopsy of the prostate. When they do biopsies, usually they stick in 12 little needles simultaneously, and he had all 12 showing cancer. It's very rare. All 12 showed cancer, and they were an aggressive cancer. Gleason was a pathologist. He tried to tell us how aggressive a cancer would be. He made a scale from 2 to 10. So from 2 to 6 is usually considered not so aggressive, and more than 6, 7, 8, 9, 10 is more aggressive. All came back aggressive cancer, Gleason 7. He had a CAT scan and bone scan elsewhere, which was negative, so the cancer hadn't traveled. His physical exam was good. And he decided to come with us because he saw the data, and our data for Gleason 7 cancer like him shows about a 90% success rate. It's in our prostate cancer booklet, and I can give you the reference if you want. So if you have the booklet, you can turn the page. If you don't have the booklet, you can call us during the work week. The booklet is fantastic because it shows our results in multiple major hospitals across the country, including even us versus proton beam. And, of course, we are better than them. That's the data. It's not baloney. It's the data. One page, us versus two big hospitals, one in Boston, one in Philadelphia for Gleason 7. We're at 90%. They're at 60%. And that's why so many men come to us with prostate cancer. We're a cancer treatment center. If you want to look at us versus proton beam, there's a big center who published the data, and for Gleason 6 and 7, their data is 76%. Ours is 14% higher in half the time. And for Gleason 8, 9, 10, proton beam was 48%. We are 46% better in half the time at less the cost, with a proven track record over 20 years. So, prostate cancer, give us a call. We'll mail you the booklet, or the best is you come in and we talk about it and go over all the details. Just a minute ago, we talked about skin cancer. One of the most severe forms of skin cancer is melanoma, and there's a new paper out this week that was in JAMA Dermatology. It was described by Karen Kaplan in the LA Times, that for pilots, airplane pilots and flight attendants have double the risk of melanoma. So pilots are 2.2 times more likely than the general population to be diagnosed with melanoma. For the crew cabin, it's a 2 times increase for melanoma compared to the general population. Melanoma is the 6th most common cancer in America, and 76,000 Americans are diagnosed with melanoma. 9,000, almost 10,000 die a year from melanoma. And multiple studies have looked at it: cosmic rays, ultraviolet radiation. Why do pilots and flight attendants get double the rate? And the mortality rate in pilots was 83% greater than the general population. The cabin crew actually had a 10% lower rate of dying than the general population. It's not UVB, but UVA can penetrate glass. The higher a plane flies, the more UVA radiation occurs. If planes are above the clouds or snow-covered mountains, they get more UVA. So it's a warning sign if you're a big flyer, or especially a pilot or air cabin worker. You may want to put sunscreen on when you go to work in the plane. I don't tell many workers while they're at work to put on sunscreen unless you're outside, but maybe being in a plane is worse than being outside, and you got to cover up. And another patient we talked about over the year, a woman who came with fallopian tube cancer. She was diagnosed at several big hospitals in Manhattan. She had fallopian tubes, are the tubes between the ovaries and the uterus. So when the little egg comes out of the ovaries every month, it travels down the fallopian tubes, it hits the uterus, and if that woman is sexually active and wanting it, and that's where the baby is formed in the uterus, but the fallopian tube allows the egg to get to the uterus. So this woman had a cancer of the fallopian tube. She had, listen to this, 5 years of chemotherapy at a big cancer institute, 18 different kinds of chemo over 5 years, and none of them worked. She had standard radiation, didn't work. She had surgery, didn't work. She came to us, 5 treatments. Her cancer, CA-125, which is a cancer marker for gynecologic cancers, her CA-125 was 5,500. It dropped by 99% with just 5 treatments, down to 50. This woman is so happy, and she got a repeat PET scan showing the cancer shrank dramatically. And she was in yesterday, doing great, working. She's 70 years old. She's working. She's married. She just got back from a cruise going to Rome and Venice and Barcelona and Malaga. Yeah, she had a great cruise, did great. That's the difference between radiosurgery, which is 5 treatments. Each treatment takes 15 minutes, and other treatments, which are endless. Elsewhere, she had 5 years, 18 different kinds of chemotherapy. The cancer kept growing. The CA-125 kept going up, up, up. Here, 5 treatments, and it immediately went down by 99%. She is happy. We're happy. It's the good news department, that's for sure. And in the other good news department, we had a patient who came in with prostate cancer. This man is 53 years old, so he's a young man with metastatic stage 4 prostate cancer. He was treated at another hospital in New York. Or I should say he was treated in a hospital. We're not a hospital. We're a private cancer treatment center. With us, you go home, you sleep in your own bed, and that's what we're devoted for. That you have outpatient, you have effective therapy, you come in, get your treatment, and go home. He had metastatic prostate cancer. He's a black man, and I say that because the death rate in black men is double that in others. The death rate from prostate cancer is double in black men. He presented with severe pain, unrelieved by narcotics, terrible pain, 5 treatments to the hip area. The pain is gone. So he is happy. He just had the treatment. Actually, after the second treatment, the pain was gone. He is so happy. So it's good news for him. We're able to relieve his pain and suffering. No one should be left in pain. Radiosurgery is very effective. It's focused on where the cancer is. It hits the cancer, which means there's less side effects. It's more likely to relieve symptoms, like in him. The woman I told you about who had the fallopian tube cancer said she wants to be our poster child because she's so happy. Well, he is there too, wanting to be our poster child because treatment was so successful and so quick to relieve his pain and suffering. And radiosurgery often, most commonly, relieves pain and suffering. And speaking about long, ineffective treatments, we had a man who came in. He's 56 years old. He came back to us. He came first to us a year ago with metastatic colon cancer. At that time, he had rectal bleeding. Actually, not that time. He had, in 2006, rectal bleeding for 4 years, and his doctors told him he just had hemorrhoids. No one looked inside. So how can you make a diagnosis if you don't look at the patient? Well, you can't. And they were wrong. And finally, he had colonoscopy, and his cancer in his rectum was so big they couldn't even get the colonoscope into the rectum. So when he was finally diagnosed, after being told he had hemorrhoids for 4 years, that he had a rectal cancer that spread to the liver. So he had surgery on the rectum, he had surgery on the liver, he had chemo, then the cancer spread, he had surgery, spread to the psoas muscle, the surgeon wanted to cut again, it spread to the groin, they wanted to cut again, but no. Finally, in January last year, he came to us. We treated the 3 spots by the psoas muscle, which is a big muscle in the back of the abdomen that lifts up the leg, and in the groin. We treated those with radiosurgery, 5 treatments, and came in yesterday, lunchtime with his daughter, and all 3 are gone. No new cancers. He had stage 4. And a lot of people say, oh, you have stage 4, you have to have chemo. Well, he had chemo, and it didn't work. He came to us, radiosurgery, almost a year ago. He's been in remission since radiosurgery, 5 treatments, non-invasive. We focus on the cancer. We hit the cancer. No new cancers. He's done great. He's fully functional. He's a crane operator. His daughter's at FIT. He's doing great. She's doing great. They are happy. I'm happy. I'm happy for them. In remission after radiosurgery for metastatic colon cancer. He was tired of chemo, tired of surgery, which was not working well for him. This is Dr. Lederman from Radiosurgery. We're going to stop for just a moment and hear from Curtis, and we'll be right back to take your calls. We're live at the WABC studio.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal